Hi, I'm Dr. Claire Harrison, and I'm a professor of haematology at Guy's and St Thomas's Hospital in London. And I'm also the lead author of the MAJIV-PV study. In this short video, I would like to give you an overview of the MAJIV-PV study in people with Polycythemia Vera or PV, what the study was about, how it was done, what were the results, and what do the results mean for people with PV. PV is a type of blood cancer where people's bone marrow makes too many blood cells, and this can thicken their blood, making it easier for blood clots to form in their blood vessels. This can increase their chances of a stroke or a heart attack or deep vein thrombosis, although not all blood clots can lead to these events. Most people with PV have a fault in a gene called JAK2, causing their bone marrow to produce too many blood cells than what is considered normal. PV can also become a more advanced type of blood cancer in some people. The main goal for treating people with PV is to prevent them from having blood clots, and in people who are at high risk of these events, we do this by having them take a daily aspirin and lowering their blood cell count with the help of medicines and in some cases venesections where we remove a certain amount of blood. The MAJIV-PV study looked at how well a drug called ruxolitinib worked in people with PV compared with the best available treatment. Specifically, we looked at people who had already taken a chemotherapy pill called hydroxycarbamide, also known as hydroxyurea, for their PV. For most people, this is often the first medicine they get. But quite often, people become resistant or intolerant to hydroxycarbamide, meaning that it either stops working for them or gives them side effects that make it difficult for them to keep taking the medicine. Ruxolitinib is a cancer drug that blocks the effect of the faulty JAK2 gene that most people with PV have. We recruited people with PV in the United Kingdom who were at high risk of having a blood clot and randomly divided them into two groups. 93 people took ruxolitinib twice a day, and 87 people took the best available therapy, including but not limited to hydroxycarbamide or an injection commonly used for PV called interferon, or a combination of these two drugs. People received their treatment for an average of 3 to 4 years during the study. Within 1 year of treatment, 43% of people in the ruxolitinib group and 26% of people in the best available therapy group achieved what we referred to as a complete response, meaning that they had normal blood counts and spleen size without needing to have a venesection for more than 3 months. During the study, fewer people in the ruxolitinib group needed venesections compared to people in the best available therapy group. We also found that compared with people who had the best available therapy, people who took ruxolitinib were more likely to live longer without a major event. By event, we mean one of the following: a major blood clot forming, hemorrhage or a significant blood loss, PV becoming a more advanced type of blood cancer, or death. Another important finding of the MAJIV-PV study was that more people in the ruxolitinib group than the best available therapy group had at least 50% improvement in their PV symptoms, including night sweats, itching, and tiredness. Also of note, we found that more people in the ruxolitinib group than in the best available therapy group had a 50% or more decrease in the number of faulty JAK2 genes in their body at the last study time point. This was associated with important clinical benefits such as having a complete response after treatment, living longer without polycythemia vera becoming worse, living longer without having a major problem caused by their polycythemia vera, living longer overall. During the study, the most common side effects were stomach and gut disorders, disorders of the blood vessels, and infections. Side effects did not increase where people received treatment for a long time and were similar to side effects that doctors know about for ruxolitinib. The MAJIV-PV study shows that for people with PV who cannot take hydroxycarbamide or hydroxyurea, ruxolitinib could help normalise their blood counts and spleen size, improve their PV symptoms, decrease the number of faulty JAK2 genes in their body, and reduce their chances of experiencing major medical problems caused by their PV. This study would not have been possible without study teams, but most of all without the participating patients and their families. We are very grateful to them, and indeed all patients who kindly agree to take part in research.